Hello, everyone. I'm so excited to be here at the Impact Maker Summit. A huge thanks to Brandon for bringing us together in this incredible space for inspiration, transformation, and impact making. It's truly an honor to speak with such a dynamic group of visionary and impact makers. Let's make the next 25 minutes life-changing. I stand before you today with a deep compassion and a commitment to guiding people toward true health. But my excitement is mixed with sadness. Because for over 41 years, across 3 different countries, I have witnessed unnecessary suffering. People trust that medicine and insurance will save them. Yet every day I see that it's not enough. That's why I'm here to empower you to take control of your health before it is too late. Today, I'm going to challenge the way you think about health. What if you have absolute clarity on what your body truly needs? What if you could take control of your health and prevent disease before it starts? What if your vitality could shine simply by giving your body the right nourishment, movement, and care? Stay with me until the end because I'm going to give you a powerful tool, my free daily health tracker. This simple guide will help you track key areas of your health: nourishment, elimination, movement, and rest in the aspect of your body, mind, emotion, and spirit. So you can finally pinpoint where your body needs attention. Let me share with the reality of our healthcare system. Share what opened my eyes to this reality. As a health professional, I have seen countless patients suffer, not because they lacked medicine, but because they lacked the right guidance. An 82-year-old man was prescribed medication to raise his blood pressure. When he came to the hospital with a lower blood pressure, yes, the blood pressure is low, now give the pill to increase it. But when I checked his chart, I found he was still taking his 3 other antihypertensive medication. His body was caught in a wall of conflicting medication. 1 medication to increase the blood pressure, 3 to lower the blood pressure. What the result is? His kidney failure. We wonder why his kidney failure. It's not because he did not take care of himself. It's because we overtreat it. So we just mask the symptoms we give. A woman in her early 40s came to the hospital repeatedly every month with the same symptoms: nausea, vomiting. What a health person will have nausea, vomiting? What happened to her? The 3rd time I work with her, I use my holistic health knowledge and release her symptoms without a pill, without a medication. Then she was able to listen to me, and she was able to be empowered to explore what's going on in her body. We end up finding her physical symptoms was her escape from emotion stress she had with her husband. They're in struggling relationship. Even when she was in hospital, her husband threatened her to take away her daughter's custody. That alone added another layer of stress. No wonder she came repeatedly. She doesn't know what else to do. Just escape from one stress into another stress without realized. Then I taught her the modalities she can do at home. After some times, she returned to her mom's role. So she continued taking care of her daughter. Then she was able to dealing with the emotion stress and dealing with the relationship. The health included not only your physical health, but also your emotional health, and the relationship is one kind of emotional health you need to pay attention to. And then I want to talk about our body's compensation. There was this woman. She come to hospital, come to ER 3 times. This the third time she need to be hospitalized. I work with her. She cried to me. I'm scared. I had to go on dialysis for life. Why? Why this happened to me? I follow doctor orders. I wait for insurance approval. I was sent by ambulance to ER 2 times. And this time, why? What happened? Why I have to go through this process, this dialysis? What have I done wrong? So I explained to her, use the holistic knowledge, tell her her body is compensating. Her kidney is compensating because when her blood sugar was critical low, the body not just quit working, the body generate sugars for her, especially for her brain. That's why when the generation cannot support the brain function, so she passed out. While I was explaining to her, she said, I see two of you. I know there's a sign of low blood sugar, so I check it. Her blood sugar was 19. The normal sugar range is 70 to 100. So you can see at a critical blood sugar of 19, she was still talking, she was still functioning. How much her body is compensating. Do not blame your kidney. What if she had a coach and tell her to look at the medication, to adjust the medication, maybe stop the medication she was taking, which supposed to lower the blood sugar, but to the point too low. If she stops the pill, she might save her kidney. We are not treating a person, we actually damage that. When the body compensated to increase the sugar and left more waste to fill out, that's why the kidney overburdened, overworked. Then all the body symptoms, include the physical symptoms and the emotional symptoms, are very complex. Sometimes it's difficult to figure out which is which and where it come from. Let's look at this gentleman, 52 years old. firefighter. He got into an accident, was hospitalized. Due to the injury, he was not able to take take food by mouth. Do you think he will frustrated? Do the people here today, do you think you will frustrated when you cannot even take anything by mouth? Yes. That's reasonable to feel frustrated. If we deal with the frustration, if we look at the process of frustration, taking care of him as a real person, he would not become a nasty man as we called him. The more we look at his nastiness, the more we get away from him. But as supposed to taking care of him, take care of him as a whole person. So the frustration added up. He became verbally abusive, destructive. He cursed the care providers. One day, he cursed away the female therapist. I'm a nurse. I must take care of the real person, not the behavior I'm looking at. I needed to take care a real person with all emotions, with all body symptoms. It's all made up this one person. By simply stay there with him, the whole incident, he was able to listen to me when I empower him to change the phrase. The word follow the F word. Replace the you with the it. That a simple change of the word he speak release some pressure. I continued working with him. He started to release his bowel movement, which he has not had for days. For the whole day, he had 8 bowel movements. I cleaned 7 times. I used the time clean when I cleaned him and taught him about the holistic health knowledge, taught him about the language effect on your physical body and emotion body. So the emotions, the frustration, and the physical symptoms are all intertwined. We have to go deeper to look at where we can start to taking care of. Once we found the starting point, we can do better taking care of the real person. These stories are not rare. They happen every day. They highlight the biggest issue we face, the lack of knowledge about how to take care of our own health, how to take control of our health. With this witness of unnecessary suffering, I summarize 3 core issues and solutions to overcome them. The first one, people rely on medication for every symptoms. A pill for high blood pressure, a pill for lower blood pressure, a pill for high blood sugar, a pill for lower blood sugar. Many symptoms come from the same root cause. Is the blood pressure high or low? They all relate to the same emotion, physical, every aspect of your body. When your body moves, circulate, freely. Your body knows how much, how high or how low your blood pressure should be. The solution, instead of masking the symptoms, track your body's signal using my daily health tracker to identify imbalances early. In my health tracker, I added, for example, in the meal, I have a time and what time during the day you eat breakfast, and also how long you take that time to eat your meals. That's relevant to your health. Also, I added what your thought was and what your emotion or your mood associated with your breakfast, your lunch, or with your sleep. You added that aspect into the tracker. So you can identify where is this trend go. Did you prefer a sweet taste of every meal, or you argue with your spouse before you go to sleep? You can find where you can take care of yourself. The second one, no one teaches us how to trust our own body. Our system do not teach us that. But we were taught to trust the healthcare system. But the healthcare system do not teach you how to trust your own body. That's where I am now, to fill that role, to teach you how to trust your body, how to take control of your health. When you tone in your body's 4 key areas, nutrition, movement, elimination, and rest, in the aspect of your body, mind, emotion, spirit, you begin to understand exactly what it needs. Let me give you an example. The constipation is not just about fibers. It's about muscle strength, hydration, movement, even your emotion. Especially for elderly, if you give a stool softener to keep the but their abdomen muscle strengths are weaker. The more stool softener you give, the more weaker their muscle gets. But for most of the seniors, you help to strengthen their muscle so they can push the waist down. Trust our bodies, not dump a pill right away with every symptoms. The third one, people wait until it is too late. Not only the regular people wait, I would say our health system also let them wait. Let's see, in so many insurance issues, the people are waiting for insurance approval, and then suddenly their symptoms get worse. Then they have to go to emergency. So why is that? If the primary doctor refer to a specialist, that take months to see a specialist. I see so many patients with cancer was delay their treatment, delay they taking care of them because they just wait for insurance. They don't know what else to do. Again, that's the area I'm looking at. What I can do for you to empower your body to heal itself, to bring out your body's inner healing wisdom. Let me share a story about wait, it is too late. This man was diagnosed with neuropathy, 10 years. Then 1 year, he was hospitalized with wound on his foot. So he had a toe amputated. The next year, that's when I met him. He had another infection on his foot. I dig deeper, explore more with him. What's the process for him to go through this wound infection? Because I already know he had an amputation last year. What happened to him? Then I found out he was diagnosed 10 years ago with neuropathy. And then I asked him how serious that was at that time. He told me, the neurologist said, his nerve is beyond the recovery. So he only needed taking some medication for pain or his tingling without anything else. If you still feel the pain, your nerve is not dead yet. Your nerve is still sending the signal. Why you think your nerve is dead? Why you wait until there's nothing else to do? Because he doesn't know what else to do. Nobody taught him them. If we can stimulate our body, stimulate the nerve, and it may recover. Sometimes even take longer, that's fine. But the nerve, we still need to take care when the nerve tingling, have pain. Not only mask the pain without taking care of our nerves. Or what if someone taught him to check his foot daily and do some massage, taking care of his foot, so his wound maybe heal better, or maybe he will not have a wound. So the solution, take care of yourself. Communicate with your body and learn what your body needs. Then apply modalities to meet that need. Talk about a little care to yourself. Now let me show you one simple exercise to improve your circulation and your energy in your body, so your body knows what to do. Okay, let me show you. Put your hand in front of you, palm down. Now use another index finger, put it on the bone, the pinky side of the bone on your wrist. Now you turn the palm towards you. Your finger didn't move, but now your finger is in the dent instead of the bone. You press it for 3 minutes. Do it 3 times a day, 2 times a day. And then you tell me what happened. Your sciatic pain may go away. Your arthritis pain may go away. If you make your body energy circulate freely, your body knows what to do. That's a repeat. So this point called aging care. Our ancient people knows The wisdom of your body even name this point aging care, taking care of our aging. Now is the time to take your action, to go home, track your daily routine, and do the exercise I just taught. And there's two more steps here. Step one, download your free daily health tracker to start identify where your body needs attention. Step two, if you are ready to go deeper, I invite you to join my one-on-one coaching. 4 weeks to discover your healing power. This will help you. We will work together to create a personalized health plan that works for your body and your lifestyle. You do not have to wait for a doctor's prescription to take control of your health. You already have the power. Starting listen to your body today. Recognize your body's wisdom, support your body's ability to heal itself. Thank you, and I will see you